One World News. I am Parul Shrivastava and you are watching our own special segment. और आज हम आ गए हैं डॉक्टर मीनाक्षी आहूजा के पास। हर साल 8 मई को हम मदर्स डे सेलिब्रेट करते हैं और ऐसे में ये बहुत इंपॉर्टेंट है समझना कि मदरहुड इज अ चॉइस। लेकिन बहुत सारी महिला आजकल लड़कियां ऐसी हैं जो कि लेटर ईयर अपनी लाइफ में प्रेगनेंसी प्लान करती हैं एंड दे बिलीव क्योंकि उनको अपना करियर प्रायोरिटाइज करना है। कहते हैं माँ बनना सबके लिए एक खास एहसास होता है। तो अगर आप प्लान कर रही हैं या आपके बैक ऑफ माइंड में है कि अभी आप करियर पे ध्यान दे रही हैं लेकिन आगे आप प्लान करना चाहती हैं, सो वी डिसाइडेड टू सैट डाउन विद डॉक्टर मीनाक्षी आहूजा, द बेस्ट इन द टाउन, एंड टू टॉक टू हर कि कैसे कर सकती हैं और कुछ सवाल, कुछ क्वेश्चंस जो आप लोगों ने हमें भेजे थे वो भी मैं उनसे पूछूंगी। हाय मैम, वेलकम टू वन वर्ल्ड न्यूज़।
Good morning and I'm really happy to be here.
थैंक यू सो मच फॉर टेकिंग आउट टाइम एंड आई थिंक आज मैं भी सुबह सुबह शूट कर रही हूँ तो वी आर ऑल्सो फीलिंग फ्रेश कि बहुत दिनों के बाद वी हैव कम आउटडोर्स एंड देन वी आर टॉकिंग टू समबडी। सो मैम, जैसा कि मैंने अभी इंट्रोडक्शन में बताया वैसे ही मैं पूछना चाहती हूँ सबसे पहले कि आजकल लड़कियां अपने करियर को प्रायोरिटाइज करती हैं एंड बी एट 25 और 35 एवरीवन वांट्स टू बिकम अ मदर, मतलब होता है सबके बैक ऑफ माइंड में। सो अगर कोई प्लान कर रही है तो व्हाट आर द ways, safe ways to plan pregnancy?
See, pregnancy at any age is safe, but definitely this has not changed. Before 30 to plan a pregnancy is the safest time. ठीक है ना, ये तो है ही है. But whenever you're planning, it's good because the problem is like you said that when girls are career oriented, which is a fabulous thing.
Yeah.
You know, when you don't want a pregnancy, you don't want a pregnancy. But when you want a pregnancy, you want it immediately, or you want it in the next 6 months because that's how it figures in your life.
Right.
So it's very important that because pregnancy can take a year or two also. Normally also a time lag sakta hai. But you people don't have the patience to wait also.
Right.
So it's a good idea to see a gynecologist for a pre-pregnancy counseling. उसके अंदर हम क्या करेंगे? We'll get certain tests done. Obviously fertility के test नहीं कराएंगे because अभी तो आप pregnancy के लिए कोशिश भी नहीं की है. मगर जनरल हेल्थ के लिए कि आपके vitamins ठीक है, आपका थायराइड ठीक है, हीमोग्लोबिन ठीक है, शुगर्स ठीक है. So that you are your optimum best when you plan the pregnancy. There may be some tests required for your partner also.
Yeah.
We'll get those done. See if there's a family history that certain things, you know, you might be worried, मेरी family में ये disease है, ये बच्चे को तो नहीं होगा, not. So that's all covered in the counseling. We'll also tell you the good days to try.
Right.
Because there are certain days in your fertility cycle which are the best days. Which if you try on those days, you will conceive earlier. So we'll be going on, you know, we'll tell you those days also. Also, we'll start folic acid. Right. Folic acid is a vitamin which every woman should start at least 3 months before planning a pregnancy. क्योंकि उससे बच्चे में नुक्स होने की कम हो
जाती है, right?
So it's a very important thing to start folic acid also at that time.
Ma'am, there were so many questions that were floating on our Instagram and there were very young girls also asking out the questions. So there was one basic question कि when is the right time to see a gynecologist? Like लोग कहते हैं अरे गायनी के पास जा रही हो भारत में, you know, people like gynecologist के पास जाने की क्या जरूरत है? What is the right time and what is the right age when you should see a gynecologist just for your health, your body?
So I've been asked this question lots and I must tell you I've been practiced for almost 30 years now. Times have really changed. About 25 years earlier, mothers were very hesitant to get their daughters to a gynae and no one used to visit a gynae unless they were planning children.
Right.
Or they were married. You know, single girls were not seeing gynecologists unless they had an accidental pregnancy which they didn't want. But times have changed completely. I have young girls brought with their mothers when they start their first period also.
Right.
Or when they're about to start their periods because the mothers may not be feeling comfortable talking about the cycle.
Correct.
So actually that is the best time to start. Because the queries also, girls are very intelligent at 13. If they have questions regarding not only their periods, their sexuality, things are changing.
Right.
You know, they are exposed to a lot of social media. They're exposed to a lot of Netflix and
Correct.
You know, international exposure is there. So they would like to know certain things and even the mothers are happy कि professional help मिल जाए. Also, अगर, you know, after periods, अगर 2 साल periods start हो गए and they have still not become regular, then we see girls at even 16 and 17 for say PCOS, acne hai, skin problems hai, weight gain issues hai, irregular cycles hai. So definitely it's not a bad idea to have a gynecologist as a backup.
Right from the beginning.
Right from the beginning, and you know who you're comfortable visiting.
Right.
So that if and when there's a problem, you can go and visit your gynecologist.
A lot of women have also asked that, you know, they फेस इरेगुलर पीरियड्स, तो वो किस तरह से इम्पैक्ट करता है प्रेगनेंसी को, एंड व्हाई इट इज इम्पोर्टेंट टू गो टू योर गायनेकोलॉजिस्ट अगर ऐसी प्रॉब्लम आपको है और खत्म नहीं हो रही है, एंड यू हैव टू सी अ गुड डॉक्टर.
So the point is your periods can be anything between 21 and 35 days. When I say 21 and 35 days, ये नहीं है कि एक महीने 21 days होगा और एक महीने 35 हो गया.
Right.
Say if it's a 26 day cycle, maybe 25 to 28 days हो या कुछ है, but it's a small window.
Right.
If they are regular, it usually indicates कि आपकी ovulation और आपका system inside for conceiving is relatively fine.
Fine. Okay.
Irregular cycles are an indicator that you may not be ovulating properly. So that will definitely not only impact your hormones and have side effects like acne or facial hair or hair fall or something, but it will also impact your fertility.
Correct.
So if you have irregular cycles, do get it sorted, even if you're not planning a pregnancy at that time. Because A, it can have repercussions for later.
Right.
And B, even at that time, it could be causing hormonal disturbances.
Right. Right. Ma'am, there was one more question and I think ये बहुत important है. जैसे we have also seen कि single motherhood का भी trend जो है वो बढ़ गया है भारत में. If you see India में women are now choosing to become single mothers. Okay, adoption is one thing, but when we see celebrities, you know, they are normalizing surrogacy, they are normalizing IVF treatment, and of course freezing eggs also and everything. But how accessible it is for common women, and actually उनको पता नहीं होता है कि पूछना कैसे है, और जैसे मुझे भी नहीं पता है कि हाउ आई शुड आस्क इट, या फिर क्या ट्रीटमेंट का खर्चा होता है, या फिर किस तरह से अपनी गायनी को अप्रोच कर सकते हैं,
and whether you need it or not in the first place.
Exactly. So I want you to please explain that also to all the women who are listening to us right now.
So how this goes is that normally if you're planning a pregnancy, say till 30, 31, it's all right. You don't need to go for IVF, surrogacy or even egg freezing. But say you're 30, 31, you don't have a partner in mind. You're not planning a pregnancy for the next 5 or 6 years. Or you may be married, but it doesn't figure in the scheme of things ki, you want to plan pregnancy in the next 2-3 years. Then freezing your eggs or freezing your embryos is a very viable option. Because जैसे आपकी age advance करती है, infertility भी बढ़ेगी.
Right.
35, 36, 37 पे अगर आप pregnancy plan कर सकते, your body may be fit. You may not have the complication of hypertension and diabetes in pregnancy. But your eggs may finish.
Right.
Premature menopause is becoming very common.
Right.
So if your eggs are stored, then we can use those eggs to get you pregnant. Of course, that would be only by, say, IVF or surrogacy. Also, the quality of eggs deteriorates with age. So 36, 37 years पे chromosomal cross-linkages and breakages बढ़ जाती हैं.
Right.
So abnormalities in the pregnancy are more common than at 30.
Right.
So if you freeze your eggs or embryos at 30, the eggs are going to be healthier. So the baby is definitely a healthier baby if the baby is conceived with a 30-year-old's egg rather than a 35 or a 37 or a 38-year-old egg.
Right.
So it is a good idea if you're not planning the pregnancy at that time to at least explore that option. और ऐसा नहीं कि celebrities करा रहे हैं. Probably we also use the name of celebrities to make you understand that normal healthy women go and get it done.
Right.
But it's the same thing. You know, you could be a journalist, you could be a doctor, you could be a businesswoman, why just a film star?
Right.
You would want your pregnancy when you want. And it's our job to see to it that you can have a healthy pregnancy when you wish to.
Right.
In the safest possible way. So this is very accessible, very doable and very legal. So ऐसा नहीं है कि आप कोई fly-by-night operator के पास जा रहे हो. We'll send you to a good IVF specialist. They will freeze your eggs. They are stored like your locker or it's stored under your name. No one else can use it. And you decide you're freezing them every year for another year, 2 years, 3 years. कब आपने freeze कर लिए अपने eggs at 30. And कब 34 पे you decide to get pregnant और आप naturally pregnant हो जाते. Right? Your eggs are frozen. You want to use them, it's okay. You want to discard them, it's okay. But at least you have a great backup healthy option for that age.
Right.
That's why it's a good idea.
Right. Thank you so much, ma'am. आपने इतने सारे points हमारे साथ share किए because Mother's Day is around the corner and you are yourself a mother. I want you to give out an important message to all the women who want to become a mother, who are a mother, कि why it is important to normalize sexual conversations, and why it is okay to visit a gynecologist whenever it is required.
That's, I think, a very important thing, frankly, because I see young girls and young women. Probably I'm also more open with my own children. They're both doctors, but yes, we have a very normal and open conversation. I have a lot of friends of mine or patients whose young girls and young, daughters, daughter-in-laws, or nieces may be visiting me also, and they're aware that they're visiting me.
Right.
So always remember that there's a lot of information on the internet. There's a lot of information on Google, but it might be misinformation also.
Right.
And your friends may have a lot of information, but it's very important to get the correct vision on everything about what is right and what is wrong, and what is the best option for you. Having a non-judgmental gynecologist who can guide you on what is required. I think mothers need to understand and say that, okay, at the end of the day, you must remember that even parents want the children's safety.
Right.
So having that, if you can't have that sexual conversation and use proper protection or understand proper protection from your parents, schools में तो पढ़ाया नहीं जाता, college में भी ये conversation नहीं हो रही. So rather than getting misinformation, visiting a gynecologist, discussing your options may be a great idea. And like I said, it's good to have a confidant in your gynecologist always.
Thank you so much, ma'am, for such a lovely and important insight that she has given to us. Remember that motherhood is a choice, be it 25 or 35. All you need is your fact should be right. So you should always visit your gynae अगर आप pregnancy plan करें. And I hope कि हमने आपके सारे सवालों का जवाब दे दिया. And if you have any other questions, you can write to us at info@oneworldnews.com. Thank you so much.
Thank you so much for having me here.
Press the bell icon to never miss a video from One World News.